Hi guys, so I am back with my second video in my All About series, and today's video is going to be on VAP, or Ventilator-associated pneumonia, and specifically we are going to be talking about the VAP bundle. So just finishing up my critical care rotation and actually being in clinicals in a critical care setting, VAP and the VAP bundle is very, very prevalent and a very hot topic in the critical care setting. So for those of you who don't know what ventilator-associated pneumonia is, it is a pneumonia that develops when you're on the ventilator, specifically 48 hours after you've been on the ventilator or after you've been extubated. So VAP is very, very costly to the hospital and has a high mortality rate for patients who get VAP, and so it's important that we prevent it, and as nurses we have the first-hand role in preventing VAP. So a bundle of things to do to help prevent VAP has been developed and has been in practice for many years, and so I wanted to touch on the things that are involved in the VAP bundle and why we are doing them. The first part of the VAP bundle is to elevate the head of the bed to at least 30 degrees or greater unless contraindicated. So elevating the head of the bed helps promote drainage, it helps prevent aspiration, and we all know when you're laying flat, fluids collect more in the lungs, and so if you are up and elevated to at least 30 degrees or greater, this can help promote drainage and prevent pneumonia. The next part is to do a daily sedation vacation to assess for readiness to extubate. So when you are in the critical care setting and you are on a ventilator, you are typically sedated using different sedations because no one likes to be awake and have a big tube down their throat. That is very uncomfortable and very scary for the patient. So a daily sedation vacation just means you're going to shut off or lower the sedation, and you're going to see if your patients wake up. You'll check their neuro, you'll see if they can squeeze their hands, wiggle their toes, nod their head. Now it depends on how severe your patient is. Some patients may wake right up and be able to communicate with you with this tube in their mouth, and some patients may not wake up. And so what you're doing is you're assessing their readiness to extubate, because the longer you're on the ventilator, the greater chance that you have for developing VAP. The next two parts of the VAP bundle, and these are done on pretty much every single patient that is in the hospital unless contraindicated, is peptic ulcer prophylaxis and deep venous thrombosis, or DVT prophylaxis. So this means giving Protonix or another proton pump inhibitor to reduce the acid produced in the stomach, because we all know that the hospital is very stressful for patients and we don't want ulcers developing. Also, DVT prophylaxis, this is your TED hose, your Lovenox or heparin sub-Q injections, and your SCDs that massage the legs and help promote venous return back to the heart in order to prevent blood clots, because the last thing a patient on a ventilator needs is to have a PE, or a pulmonary embolism, that goes to their lungs and causes infarction or pneumonia, or even worse, causing death. The last part of the VAP bundle is to do daily oral care with chlorhexidine. Now, every hospital has different policies. Some may require that you do this every 2 hours or every 4 hours. Some may require once a shift. Some may require that you do it every 2 hours with the chlorhexidine, and then Q shift you do it with a oral swab, toothbrush, and chlorhexidine. There are many different ways to do oral care. There's many different studies out there that look at the benefits of doing different types of oral care to prevent VAP. So it really is per policy, and all of these things in the VAP bundle are per hospital policy. Most hospitals will practice them. It just depends on how often they require that nurses perform these tasks. So with the oral care, you are preventing pneumonia by cleaning the mouth and reducing the amount of bacteria that's in the mouth that could potentially be aspirated and cause pneumonia. And so oral care is one of those things that I think a lot of nurses neglect, or they will say they did it, but they didn't. And it is very important to do oral care because you don't want bacteria being aspirated and going into the lungs. The mouth has tons of bacteria in it. It's a very, very dirty place. And you don't want to be the nurse that just doesn't do oral care because you don't want to, or you think it's gross. and then your patient ends up with pneumonia because they aspirated. Alright guys, so I hope that helps explain the VAP bundle a little better to you guys. I know that when I was going through critical care, the VAP bundle was a very big thing that we had to learn. We were tested on it. I saw it in my clinical setting. So I hope this video helped you all out. If you have any other suggestions for all about videos, I would love to hear your suggestions because I am having a hard time coming up with some ideas. So leave those in the comments below, or you can always Instagram me or Twitter me and tell me your suggestions. Alright guys, so make sure you give this video a thumbs up, subscribe to my channel, and I will see you next time. Bye!